Hello and welcome to Sick Notes. My name's Ed Hope. I'm a junior doctor from the UK, and today I'm going to be looking at the House episode from season 1 called Control from a Real Doctor's Perspective. Now, I've done a few of these reviews and reaction videos to House and other medical TV dramas, but this one I'm going to be doing a little bit differently. I'm going to be challenging myself to see if I can guess what happens next and guess the diagnosis before House. Now, I did this as a section on a live stream last week with one of my colleagues, Dr. Lizzie, and she did really well at it. So the pressure's definitely on me. So if this sounds like the content you might be interested in, then please subscribe to the channel, join our family here on YouTube. Now, full disclosure, I am a House fan, so I have seen all the episodes, including the one I've looked at, but not for many years. And when I looked at the previous episode, I didn't remember much from it. But I do remember that there are always bizarre diagnoses, so that might help me out. But either way, we'll have a lot of fun revisiting it and hopefully learn a bit of medicine on the way.
India has over 500 million women. In terms of spending power, it's the single largest potential market in the world. We have retained a local firm to ensure that cultural differences are respected. However, I can't go into the specifics of my plan with you until tomorrow. Right now, I have a meeting and I need the room.
We were just getting started.
I know, and I do apologize. It's last minute, but the meeting is with 3 State Department officials to smooth the way for China.
China? This is just incredible.
We'll be in touch.
Thank you.
What is it? I need a doctor. I can't move my leg.
Okay, so we have the premise, we have our patient here, a young lady around about early 40s, sudden onset, unilateral, that means one side, loss of function of her lower limb. Now, the sudden onset, we should be thinking about a vascular cause, because if there's problems with a blood vessel, like a blockage, then the tissue supplied by that blood vessel will be starved of oxygen, and we see changes very quickly. The loss of function, we'd really worry about that happening in the brain, what we call a stroke, and that would be the area that would control the leg. That's why we'd lose the function to it. Although the patient here is also looking like she's in a bit of pain, and strokes don't normally cause pain. So perhaps it's a blockage of a blood vessel in the leg, which would both cause loss of function and pain, kind of like House had, that caused his leg pain. So this would be my first thought, but given the fact the patient's a female and young, makes vascular disease a lot less likely because estrogen is protective from vascular problems. Other things that would be running through my head is if the patient had any back pain. So if we get compression of the nerves around the back that supply the legs, we can get terrible pains in the legs, so-called sciatica. And although the timings don't fit, I'd also be worried about something like a deep vein thrombosis, so a blood clot in the venous system, not the arterial system. And I'd also be wary of any kind of infective cause within the leg as well, but again, that would take a little bit longer to manifest. So at the moment, nothing's quite off the table, but I would say so far I've plumped with a problem in the arterial system.
32-year-old female, paralysis and severe pain in her right quad. Go.
Okay, whoops. She's actually 32 years old and not in her 40s, like I said before. But you know, when you watch these old shows, people always look a little bit older than you think they are. But we have confirmed that she's got loss of function, so paralysis in the lower limb, and also pain, what we thought as well.
She's the CEO of Sonyo Cosmetics.
So she's a CEO of a cosmetics company, so I feel doubly bad for getting her age wrong. I'm just going to throw this out there because a CEO of a cosmetics company in an episode of House, you've got to think that's relevant. So some kind of chemical exposure maybe, or some side effect to some beauty treatment, none of which I know off the top of my head would cause any leg pain. So let's find out.
She may have what you had, a clot in her thigh.
Bit of a long shot.
What about a disc herniation?
So there you go. We thought, as Cameron did, that it's a vascular cause given the sudden onset, but it is unusual for her age group. And Foreman is talking about a problem in the back, so a disc herniation. Let me show you on Nina. So we have our bony vertebra here and our intervertebral discs in between them, kind of like shock absorbers. And we have our nerves that come out from the spinal cord at the side here. So a disc prolapse is where one of these intervertebral discs bulge out and put pressure on this nerve. and that causes pain in the area where that nerve will innervate. So in this case, in the lower back, will cause pain in the legs.
Suppose.
You're right. A clot's also the most deadly, right, Robert?
True. If the clot breaks off, she could stroke and die.
If the clot breaks off, I see what he's saying. If there's a clot in the leg is what they're thinking about, then that can't break off and go anywhere because it's kind of a one-way system. It's not going to go back up to the head and cause a stroke. Now, I understand kind of what they're getting at though, because if there's another reason why the patient's producing clots, so if there's an irregular heartbeat, or if there's a hole in the heart, or an infection of the heart, or if there's something wrong with the actual blood constituent, so some inflammation or something wrong with the clotting factors, all of these predispose the patient to clots, which could also produce a different clot that can break off and go to the head and cause a stroke. But certainly if we're thinking just a blood clot in the leg, that can't then cause a stroke.
Put her on blood thinners, do an angiogram. When that comes back negative, MRI the spine. If that's clean, cut her open and biopsy the leg.
Okay, very good. So they're treating for a vascular cause. They're also thinking about doing an MRI of the spine to think about what we showed on Nina earlier, see if there's any problems with the disc. And they're looking to do a biopsy of the leg as well to see if there's anything wrong with the muscle. It's all relevant stuff to what's going on, but it's not particularly good medicine. We'd really want to do a proper history and examination, and that would make things a lot clearer what your differential is going to be. So a vascular problem is very easy to examine because you get such drastic changes to the area that's losing blood supply. But clearly that wouldn't be as exciting for the story, would it? So now the patient's having an angiogram.
Pretty sure my X-ray machine can take your phone in a fight. It'll fry it.
Okay, let's just go back to these shots. So looking at this, firstly, it's an X-ray of the right knee. So we have our femur, our thigh bone on the top here, and our tibia, our shin bone down the bottom. And you see this little round shadow, that's the kneecap, the patella sitting on top. And can you just see a faint outline of the fibula? So that's on the lateral side of the legs, and this must be a right knee X-ray. Secondly, this is not the X-ray of a 32-year-old. This is someone much younger, probably around about 16. On an X-ray, because the X-ray don't pass through the bone, it becomes quite white on the film. So therefore, that's why we see the gap in the joint here where there's no bone. But can you see these lines here as well that go through the bone? These are the epiphyseal growth plates. So this is an area of immature bone. That's why it's less dense. And that's how your bones grow. So our long bones in our body, they don't just grow all the way through them. They grow on two plates just inside of the joint. So that's why I know this is from a younger patient. And these tend to seal up before you're 18, but can happen at different ages. So that's why this isn't the X-ray from the lady unless there's something really bizarre going on. Okay, I've never had to read an angio before. This is usually done by a radiologist, but it looks here that there's no obvious blood clot going on here, so I'm guessing the angio is going to be normal, which goes along with our diagnosis that it's never normally the first thing that House thinks of.
Our initial tests say you're fine. We think you had a clot, but it resolved on its own. So we're gonna keep you overnight to be safe, and you can go back home tomorrow. Or back to work.
I'm just going to stop it there because this is an interesting point. So our rudimental reading of the angiogram was correct. There's no blood clot in the patient's leg. The patient's now an inpatient, so we'd expect routine blood tests have done, and that will help us rule out infection, inflammation, even a deep vein thrombosis, and other investigations would have been done as well. So a chest X-ray, an ECG, and an echo, because we talked about cardiac problems potentially causing clots as well. This is not an unusual situation to be in, where all the tests are normal, and then it's really based on the clinical picture. Clearly the patient is still in pain, so we'd keep them in and we'll monitor them and then reassess if they're getting better or worse.
Get in here! I need a line in her. IV morphine stat!
Okay, clearly the patient is getting worse, so you just have to reassess. So go back to basics, revisit the history, revisit the examination to see if there's anything you're missing or that anything has changed as well. In-house though, it is difficult to predict what's happening because you're not exactly sure what investigations they have done or haven't, like the ones we talked about before. But yeah, if this was my patient now, I'd just go back to the basics and see what's changed. In terms of what it might be, I'm a little bit stumped actually. So we'll see if there's any more clues.
It's not an inflammatory process. It's not a clot because Chase's angio says so. And it's not cancer because her tush is perfect. Anybody else got an Aunt Lisa with weird stuff? You guys see the problem here?
There's no indication of any abnormalities. No lesions, no spurs, no
Her
masses.
toes are screwed up. They're backwards. You guys know how much surgery it's gonna take to swap them back?
What are you talking about?
Well, either she literally has 2 left feet or you angioed the wrong leg.
Hang on a second. Let's revisit that angio. That is clearly the right leg in both senses of the word. And in this current scene, that is a left foot, but that is still from a right leg here. Anyway, in terms of the story though, it's irrelevant. They say they've done the wrong leg, so let's just stick with that. This is pretty realistic, sadly. You only have to do a little bit of research on Google to find, you know, loads of history of people having medical procedures on the wrong side. You know, even as drastic as having things removed. So, you know, I heard of one where fallopian tube was removed from the wrong side on a lady, rendering her infertile. Absolutely crazy thing. So, you know, they're highlighting something here that absolutely happens. And in a way, this is what I meant when I talked about going back to basics, looking at all the evidence you had, because if something isn't right with the patient and it doesn't fit what's going on, then, you know, the patient kind of isn't lying. You know, that is how it is. And what you're looking at, there must be a gap somewhere that isn't explaining things.
My chest hurts.
It's from the tracer I injected. Might also get a little nauseous or have a metallic taste, all normal.
Okay, so the patient has another angio, this time of the correct limb, the right limb, even though we think that's what they had it on last time. But Forward's absolutely right here. If you guys have ever had an angio, please let me know what side effects you've had from it, because I had one before, after I had a car accident. Thankfully I was okay. But I had the metallic taste in the mouth, and also when the contrast went around the blood vessel of the bladder, it made it feel like I'd wet myself, which thankfully I hadn't. But yeah, it's a known side effect basically to have that sensation.
Carly?
My chest. My chest.
Respiratory arrest. Call the code. What do you got? She's drowning.
Okay, so we're starting to pull things together a little bit. So when they say the patient is drowning, I think what they're sort of getting at is the patient is having acute pulmonary edema. So pulmonary meaning lungs and edema meaning fluid. So this is where we get fluid in the lungs due to the heart failing, because when the heart begins to fail, it's unable to pump blood around the body. So the blood coming into it begins to build up. So we get congestion, just kind of like a traffic jam really. Before the blood's pumped around the body, it comes from the lungs. So all this blood builds up within the blood vessels around the lungs. This means that the blood vessels become under high pressure, and this forces the fluid out from the blood supply into the lungs, causing the pulmonary edema and causing the difficulty in breathing. So let me briefly give you an overview of what could be going wrong with the heart. Whenever we think about the possible problems with an organ, we just need to think about what the organ is made up of, and then we can figure out what things can go wrong. The heart is a beautiful muscular pump. So just like any pump, it needs 3 main things. It needs a physical structure to make that pump possible. It needs to be well coordinated, and it needs a power supply. So let's see how the heart deals with those things. So here is our heart, 4 muscular chambers separated by valves, with some linings around it as well. So potentially damage to any of these three parts, if severe enough, can lead to heart failure. And to coordinate this complex contraction of these muscles, we need a dedicated electrical system. So these blue lines represent the specialist electrical conduction system of the heart that helps coordinate it. Again, any severe damage to this can also cause heart failure. And finally, we have our power supply. So the pink represents the coronary artery, so the specialist blood vessels that supply the power in the form of blood to the heart muscle. They're called the coronary because coronary means crown, and these blood vessels start at the top of the heart and encircle round. Problems with the coronary artery, so-called ischemic heart disease or cardiovascular disease, is actually the biggest cause of heart failure. So anything wrong with the structure of the heart, the electrical conduction system, or the power supply via the coronary arteries can cause heart failure and therefore cause pulmonary edema like we saw in this patient. But the question is, which one of these problems can also cause the leg problems? Throughout the episode, we've been thinking about a blood clot, and that would tie something wrong with the heart and something wrong with the leg together quite nicely. Let me just briefly explain. So, problems with the structure of the heart that can cause blood clots, well, we might have a hole in the heart. This would mean that blood's more likely to have little clots from the venous system. So the venous system may go into the arterial system and send a clot off. So that may send a clot out to the leg. The fact that the heart's got a hole in it may lead to heart failure. This is unlikely though, because we don't tend to just have a hole in the heart just appear out of nowhere. So it won't really happen acutely. We may have a problem with one of the linings of the heart becoming infected, called infective endocarditis. The infection can cause these little vegetations that mean clots form in the heart and therefore will be pumped out. So we can get heart failure from the strain of the heart due to endocarditis, and also forming blood clots that may go to the leg. In terms of the electrical activity, if we have an irregular heartbeat, that means that the blood won't flow through as smoothly. So we'll have pools of blood form, and therefore that might clot and again send a clot out around the body. Problems with the blood vessels, so both the heart and the leg have significant blood vessels, so it may be some kind of inflammation like a vasculitis or an autoimmune disease going on there, or it may be just that they're more predisposed to clot due to a clotting abnormality, and we just so happen to have a clot in the heart and a clot in the leg at the same time. So a blood clot does tie them together nicely. However, we find out that the repeat angiogram is actually normal. So there's no blood clot in the leg. So it then begs the question, well, what can link the heart and the leg together that isn't to do with a blood clot? Well, I think the obvious thing is the structure of the heart. So the muscle, they both contain significant muscular elements. So the thigh, the quadriceps in the thigh, and also the myocardium, so the heart muscle as well. We can get damage to muscles from various things like viruses, autoimmune disease. So given the patient's background as a CEO of a cosmetics company, I'm going to throw a wild guess, but they're always wild in-house, aren't they, that there's some kind of environmental exposure at the cosmetics company that has led to some kind of inflammation of the muscle, some kind of muscle damage to the heart and to the leg. CEO of a cosmetics company in an episode of House, you've got to think that's relevant. So some kind of chemical exposure maybe, or some side effect to some beauty treatment. So let's find out.
And how that
You're a high-powered bulimic. You make yourself throw up. You had to find the most efficient way to vomit without revealing the telltale signs of bulimia, which is all very unseemly for a CEO. So you found a common antidote to accidental poisoning to do the job, Ipecac. Which is great if your kids just swallowed a bottle of aspirin, but really, really bad if it's a habit. Causes muscle damage, causes the pain in your leg.
Okay, so it makes sense. So we really weren't that far off actually. So it's less about her being in cosmetics, but more the fact that she is a CEO and so needed to be in control, hence the name of the episode. and this manifested itself through patterns of self-harm and also bulimia. So the medication to make herself sick also caused damage to the muscle and the heart. So I've not heard of Ipecac, so I was just checking it out on Wikipedia. That's right, very trustworthy medical source. And it was used to induce vomiting. You know, when people have taken poisons, we used to give it to them to try and get rid of the poison from the body, but it's no longer used because there's more effective treatments. But it is known to have been abused by people that suffer from bulimia, and also known to cause, in those patient group, cardiac and muscle problems. And sadly, this story appears to be, at least in part, based on Karen Carpenter, the singer from the Carpenters, and contributed to her death. So I'm sorry, you know, that case ended on such a kind of tragic insight into real life, really. So I hope you enjoyed looking at this episode from more of a medical point of view. There's lots of other things to it. So there's also an ethical dilemma where the patient is put forward from a heart transplant when they shouldn't be. The episode handles that quite nicely, actually, so it's worth checking it out for that. And there's some other sort of main plot points as well that drive the whole season that I've missed out as well, but definitely worth checking it out. I did really enjoy the episode. I thought we did all right as well. We got kind of close to it. I think in reality, the vascular cause could have been ruled out a lot quicker on examination. But in terms of what was real is that a patient like this isn't going to get diagnosed overnight. Okay, it may be slightly more dramatic than normal, but given how bizarre this case is really, and the fact it is based on reality, it would take some time to piece together exactly what was happening. So, you know, House did a pretty good, the House and the team that created it done a pretty good job of representing this. So it just leaves me to say thank you so much for watching the video and all the support you guys are giving me on the channel. If you like this and kind of wanted to see more, then please let me know, because that helps shape what kind of ideas I come up with. Or if you kind of preferred the more traditional reaction reviews, then let me know as well too. So until next time guys, take care of yourselves and I'll see you soon.